Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, why is systolic heart failure a heart failure with reduced ejection fraction, and why is diastolic heart failure is a type of heart failure with preserved ejection fraction? So, for that, what is ejection fraction first? Ejection fraction. In ejection fraction, ejection fraction is the volume of blood, volume of blood ejected by each ventricle in one heartbeat or one pump divided by total volume present in the ventricle, present in that ventricle. Okay, so this is ejection fraction into 100 if you wanted to express it in percentages. Now if the volume actually, in we will see what happens in systolic heart failure. In systolic heart failure, the volume of blood ejection, so in systolic heart failure there is pump failure of the heart. The heart is not able to pump properly. Here there is problem in the pump, so there is pumping failure is there. So as a result, the volume ejected by each ventricle is, so in systolic heart failure the volume ejected by each ventricle is less, right? The volume ejected is less, so the numerator is less in systolic heart failure, whereas the total volume in the ventricle is normal. In each ventricle, the total volume that each ventricle receives is normal because filling is normal, but volume ejected is less. So overall, if you calculate the ejection fraction, obviously because the numerator is decreased and denominator is normal, so ejection fraction will be decreased. Okay, so as a result, in systolic heart failure there is reduced ejection fraction. Then if you do the same with diastolic heart failure, in diastolic heart failure, here the volume ejected is normal or it is less. Actually, 1 minute, let me tell you. Here the problem is in not in the pump failure, it is systolic heart failure. In diastolic heart failure, the problem is in the filling of the heart. Whatever the reason is, the heart is not able to fill properly. So the volume ejected by uh, the volume ejected by the ventricle is definitely less, and the total volume of the ventricle, it is also less because there is less filling of each ventricle. So obviously total volume of the ventricle is also less. So if you see, both are decreased, so the ejection fraction is normal in diastolic heart failure, that is ejection fraction is preserved in diastolic heart failure. So in diastolic heart failure there is preserved ejection fraction.
thank you and thank you for watching.